main pharmacological treatment that we've used over the years to try to help people with dementia has been based on trying to boost the cholinergic system. And yet perhaps we haven't been given enough focus on the harm we may be doing to the cholinergic system with other medication. And that's why I think anticholinergic burden is a really important subject for anybody working with people with cognitive impairment. My name's Ross Overshott, and I'm an old age liaison psychiatrist working in sunny Manchester. And those of you who have been to Manchester may know that there may have been a bit of a fib in the sunniness that I've just mentioned. But certainly sunniness and actually being bright is something that we at least try to establish with people when they have cognitive difficulties, to try to make the most of the cognitive function they have. Hence the boosting of the cholinergic system with acetylcholine being so important as a neurotransmitter for attention, concentration, and memory. And yet there are many medications that people have prescribed that have anticholinergic properties. And this can lead to a whole manifest of side effects, which are really quite troublesome. One of the key things I see people often experience is dry mouth, which is also an anticholinergic side effect. And I always think, well, if it's dry in your mouth, it might be dry in your mind, i.e. the speed of your thinking. We therefore need to actually consider prescribing of all medications for people with cognitive impairment. There is a rating scale, if you've ever come across it, the anticholinergic burden or the anticholinergic effect on cognition scale. It's a very simple thing. 0 really means minimal anticholinergic effect, then 1, then 2, and the maximum being 3. I hope that one day we will try to be avoiding completely that anybody being prescribed one of the medications that scores 3 on this scale for anybody who has a cognitive impairment, and even hopefully for people even younger, because these medications can certainly have quite an important effect on our cognitive function and actually lead to a deterioration of it over the years. It is weird if you think about it, that we give these medications, anti-dementia medications, to boost the cholinergic system, and yet the person may be on some other medication that will make the actual cholinergic system not function as well. So we're giving with one hand and we're taking with another. Whilst I want us to avoid these medications that score 3, it's quite easy to accumulate 3 and even more points through other medications. At the end of the day, when we're working with people with dementia, we want them to be living where they want to be safely, and also seeing the people they want to be seeing and doing the things that hopefully give them still good quality of life. But overall, we're also in the brain saving business. And that means trying not to harm their brain and their cognitive function. We therefore, there's a lot of gains, a lot of positives to be had by reducing people's anticholinergic burden. But we can only do that if we know what actual medications have been prescribed and the harm that they could be doing them. Ultimately, we want to be trying to get people to score 0. That may not always be possible. There may be good reasons why people have to be on certain medications, but certainly we need to keep it in mind in that respect. The reason why? Well, if you've got quite a strong anticholinergic burden, you're more likely to experience hallucinations. So this is particularly harmful for people who've got quite low acetylcholine function at the time, people with perhaps Parkinson's disease or dementia with Lewy body. There's also an association with higher mortality and actually an overall cognitive decline. And it's not unusual to see people develop hallucinations for the first time when they've been started on some medication. But I'd also come back to the patient experience. Experiencing constipation, dry mouth, blurred vision is no fun for anyone, but particularly disorientating for people with dementia. And that's why I do think we need to be smarter in our prescribing. So therefore, I'd ask all of you to have a look at the medications you're prescribing, understand which ones perhaps are best avoided if at all possible. There are many websites and tables which will show you which medications have a strong anticholinergic burden, and generally which ones will score 1 or 2 points on that accumulative effect, because that's really important to consider. The website I prefer is www.medicheck.com. That's Medicheck without a K at the end, CHEC. And I think that's a really helpful website because it considers which medications actually have the cognitive effect. Because some of these medications will be anticholinergic in nature, but actually it's whether they have a cognitive effect that's really important. This is a specialist website which will then rate medication and particularly look at their cognitive effect on people. I hope that's something that is something you can take forward in your own prescribing, your own actual working lives with all your patients, of actually understanding what cholinergic burden people are suffering.